do an upgrade and you can't get on. Are we there now, Wendy?
We seem to have had a few more people join, Chair. Yeah.
Yeah, and I think we're on the hour. Is that right?
Yes, I make it 10 o'clock.
And there's still a few joining. Actually, I might just give it 1 minute. Get a few more in. Karen, I've sent you a text. Okay.
Yeah, received. Thanks, Karen.
Thank you. Thank you. Thank you. So I think it looks as if we've got quite a good number. So I am going to make a little start on our meeting. Firstly, I think I'm still in order to say Happy New Year to everyone. It does seem to have been a very long January, but it is still January. So Happy New Year, and I hope you all managed to get a break over the Christmas period and a bit of a recharge, because I think everyone has found this year particularly stressful and challenging, and I don't think we've ever worked quite as hard as we have over the last year. So I think we all deserve a pat on our back and a bit of congratulations, because actually local government and the health service together have done a heck of a lot to support our communities, and that's really down to all of you. So well done, well done. So we've got the main item on our agenda today is the Health of the Region report, which of course we've seen before, and that will come forward. But I wanted to I'm actually trying to find a quick note, because I know we've got some new people with us today, Mubashir, haven't we? And I wonder if perhaps I'm sorry, I've lost my notes on this, and please forgive me for being very poor chair at this point, but I wonder if you could update us.
Absolutely, thank you, Chair. So yes, we have Tatum Mathuru with us today, who is going to be taking on as head of Thrive for interim head of Thrive for 6 months, while Sean Russell, who has been leading on our COVID response, is going to be focusing on that for the next 6 months. So just a huge welcome to Tatum, and a huge thank you to Sean, who's also going to give us a quick update on the COVID situation, Chair.
Exactly, and Tatum, you are most welcome. And I think if you can lift some of the burden off Sean's shoulder whilst we go through this still, it will be fantastic. Sean, we've all been rather shocked by the current lockdown and the figures and everything, and I think it would be really helpful if at this point you might be able to give us a quick update on the current state of COVID in our area.
Thank you, Ma'am. I'm just going to share my screen if that's okay, and
yes,
see. I've just done a very quick COVID report, if that's okay, just a quick presentation just to show you where we are, if that makes sense.
That would be most welcome.
Thank you. So hopefully you can see it slowly coming onto the screen.
Not quite yet. That's it. I think it's coming.
Okay, I'm very sorry.
Affected by the cold weather.
I think it's out in Warwickshire at the moment. It's broadband speed is a little bit diminished.
Very white. Yeah.
So really, what I'm trying to do is just give you a quick overview, and I'll run through this really quickly because I know we've got a packed agenda. But the number of cases are showing a plateauing or decreasing across most of the areas nationally. Although that's not the case in the West Midlands. We are in a position which I'll talk through here. So the UK average is running at 42,000 cases per day compared to 53,539 last week. So it's a significant drop nationally. The national average is running at 497.3 cases per 100,000, and that was 654.9 on the 14th of January. So I'm trying to do a week by week comparison just to show you where we are nationally. The positivity rate at the West Midlands for the combined authority footprint is currently sitting at 20.0 compared to 14.3 nationally, which is pretty high. And then actually what we've seen is the numbers in the West Midlands are reducing, but not at the rate of the national position. So our average at the moment is 717.6 compared to the position I showed earlier. Worryingly, though, is our over 60s rate, and we are sitting at a higher rate across the board, sitting at 614.7 for the West Midlands, with Wolverhampton our highest rate at 842.1. Now, if you look at the table on the right-hand side, that basically gives you an overview of where we are. We've seen an 11% drop in the West Midlands compared to a 33% drop in London. And when you put that into context now, Sandwell is number 3 in the National League table. Wolverhampton is number 9. Birmingham at 35 this overnight. So for me, it's really, really interesting that we understand that. But we do know why, and that's the important part. So we don't lose hope. So that just gives you a sense of where we are in the graph. Since we saw a rapid climb for us on the 16th of November, then we saw another climb for the second wave, which was last week, and that was hopefully our peak. Now you're starting to see it diminish again, as you can see in the graph there. But, you know, if you remember going back to probably May and July time, we were talking about numbers of 15 and 20 per 100,000 being really worrying. Now we're talking about anything over 500 not being worrying. And so we've just got to get a sense of where we were comparatively. That just shows you the overnight figures where we were, again, just to show the population position, but Sandwell running at the highest level of positivity test at 24. But it just highlights there that actually some of our areas across the boroughs. But actually, on the right-hand side, you can see the 7-day rate change. The percentage is dropping nicely. And Rugby has seen a nice drop of 24%, Stratford 17%. And then the over 60 rate is also dropping in a number of areas. But you can see there are some areas that are increasing, including Coventry, Dudley and Sandwell. Now, that is on a day-by-day basis. Warwick has seen an increase. So actually, that is a specific day-by-day. So that may drop overnight and then back up again the following day. So we just have to be thoughtful about that. So just to show you about hospital admissions, actually increasing the pressure in the NHS at the moment. And I know we've got the NHS on the line with us today. It is significant for us at the moment, and they are feeling the pain. That map, the graph there on the left-hand side, just shows you that actually the Midlands now are second in the country for the surge capacity requirement compared to the national picture, and before that was the southeast, as east of England, and then London. So we're gradually moving up that scale, as you would imagine. Total deaths now is 94,580, so we're moving towards that 100,000 nationally, and we've seen across the West Midlands combined authority footprint 4,842. And again, we saw a rise to 368 last week compared to 277 the week previously. So a really sad time, actually, for lots of people with their families and the position we're in. Vaccinations, though, very quickly. You'll have seen, therefore, that we're doing really well, actually, in the vaccination front for the Midlands region. This was taken off yesterday. That shows the 7-day average for the UK is running at 281,500 vaccinations per day for a 7-day average. We are on track to hit 12.2 million vaccines by the 15th of February, but our ambition is 15 million. So there's clearly a little bit of work to do. But I know the NHS and the local areas are doing amazing work actually to get that done. So that's really helpful. And then just to show you the figures that came out late last night, actually around where it is at STP footprint. You can see there that Birmingham and Solihull are 37.8% of the total vaccines for the West Midlands Combined Authority footprint. Black Country 37.4, and slowly behind them at 24.8 is Coventry and Warwickshire. And the reason for that is actually some of that is around the allocation of it due to the population density and a whole host of other things, but that will equal out over time. And you may have seen in the press today that they've already pushed very highly in the north of England that they're going to start to move that away to the rest of the country. But the important bit is the Midlands has got 19% of the vaccination totality, which is higher than any other region in the country. So we should really have a big slap on our back for that to say really well done going forward. So really finally then, the things that are driving the transmission at the moment really is about workplace and the home environment. So we do know that lots of people are going into work and then transmitting that position to their wider family. and we have got to work on that. So we do know that people are going into work when it's not impossible to work from home. We've had employers who are trying to get people to go into work, and we've really got to reiterate that message. The other secondary bit for me is actually that's impacting on schools. The volume of people in schools this time compared to the first lockdown is significantly higher, and therefore we've got to be really thoughtful about that. And there's anecdotal stories of lots of people actually turning up at school with their children saying they're a key worker when potentially they're not in the critical worker list that we would normally have suggested in the first lockdown. So it's really, really important that we start to focus on that driving forward if we're going to contain the virus going forward. The other bit for me is actually when people go out, they forget that they've done so well being in lockdown. But actually, when you go out for your little bit of exercise and you bump into a friend you haven't seen for a little while, you're not maintaining that 2 metre distance. You're probably standing for a few minutes without your face covering on properly. And therefore, we're allowing the transmission and breaking all of that really good work that we're doing. So it's really important. And then finally, as we'll talk throughout the rest of the programme, mental health of our workforce is really important because actually we're starting to see significant issues, and I'll talk a little bit about that through the rest of the presentations later today. Hopefully that provides you an update as to where we are, Ma'am, and happy to take any questions.
Sean, thank you. That is incredibly useful and gives us a really good perspective of the region. It's been a very tough time, and I have to say, every day I'm seeing deaths in my part of the world coming through, and I think we have to just be very conscious that behind every number there are not only individuals, but there are families who are involved in that, and it's a desperately sad time, as you said. So it is for us to note that, and any messaging we can do to help people, one, to keep the compliant with the isolation, but two, to take up the vaccine is a really important messaging that we need to do. So Karen, and then Stan's going to. Karen, do you want to comment on that, and then I'll bring Stan in, who might have an update on the health situation. Thank you, Karen.
Yeah, thanks for that, Sean. That's a really good overview of what's going on. Just to come in on the comms point of view, I know all local across the leaders across the combined authority areas get together weekly and sort of determine collectively their comms messages, but then obviously we focus on certain elements locally. There is something I put out yesterday was around the vaccination does not give people the golden ticket to go and do what they want. So I think on top of what you've already said, there is that message around, yes, people get the vaccine, but once they've had their first dose, does not give them the license to go and do whatever they want. So that's one point to make. I'm just wondering if you've been involved with the Behavioural Insight Unit, and I know they've, what do they call it? They've stratified thousands of people to see what people are doing through this pandemic, and about sort of bending the rules so that, what you said around, people going to work when they don't need to. Sort of what information are we picking up from the Behavioural Insight Unit that you can share with members?
Well, I'm very conscious this is not an agenda item, and I'm happy to because it is important for all of us. I don't want to get too deeply involved in it, and I think if we can, we'll just keep it lightweight. But I'd like very much to hear from our health colleagues, who we have to recognise have been going through a really torrid time, and we all salute and support you. Stan, please do come in.
Thank you very much, Chair. I'm here to represent Paul, as you know, and I'm the interim chair of the CCG at the moment, hopefully for not much longer. I think there's going to be a substantive chair appointed soon. I'd like to pay tribute to all my colleagues in the health service who are shouldering a very difficult burden at the moment, and it's great to see how we're delivering the vaccine programme. People being vaccinated at hospital hubs, mainly health and social care workers, and also at the mass vaccination sites and primary care network centres. And the GPs are focusing on vaccinating the more elderly among us, and will be slowly working through the top 4 cohorts as designated by the joint vaccination group. The mass sites are opening up. Millennium Point was the first, and there are others to follow at football grounds and cricket grounds in the NEC. I've been to the Millennium Point myself and actually done some vaccinating there. It's a great facility, easy parking, easy access, and there's good flow through. Supplies are improving, and I think it's great. We must emphasise to the population that the vaccines are safe. They have undergone a very rigorous assurance and testing process, and also for people who have concerns about animal products, we've got to reinforce the fact that the vaccines contain no animal products whatsoever, so they're safe for all groups who have concerns in that regard. But I would like to echo what Councillor Grinsell said about behaviours. It's really important that people continue with social distancing, with face coverings and washing their hands, face, space. There's quite a few instances where people have caught COVID after their first vaccination. It takes several weeks for the vaccine to produce a level of immunity, and it's so important that these messages are reinforced.
Yeah.
The other thing to mention is the increase in hospital admissions and burden on the health service, and the burden on people working there, both physically and mentally, and we have to bear that in mind. I'll stop there, Chair. Happy to take any questions.
That everything you say absolutely has real weight, and you know, and the other point about the vaccine, that is, I actually took my mother-in-law for her vaccination last Saturday, aged 90, and there was a great sense of uplift in the vaccination centre, which was at a GP practice. They had four units that were vaccination, and it was fantastic. And we were late in the day. It was about 7:45. They'd been vaccinating 8 o'clock till 8 o'clock, and they had done 450 in that day. They'd only opened the day before, so that was pretty good. And I was aware too that when we went in, they had 9 left to vaccinate, and they had 12 shots left. So it was very well done, very well planned, and there were no shows. Really positive. And those were not going to be wasted, because one of the vaccinating nurses was going to phone her elderly mother and bring her in. You know, it was all going well. That said, the messaging that came very much from the vaccination centre was, you are not immune and you must not behave as if you're immune yet. It will be some weeks. Exactly to your point, Stan and Karen's. And the other point, of course, is that we still don't know, and I believe you can still infect other people, even though you might have had your vaccination. There is still a possibility. So we still will have to behave cautiously and carefully, and remember the pressure on the NHS. And if we want to get back to normal, we must behave as if we all have this awful virus. Paulette and then Guy, and I promise you after that I will get to the agenda.
Right. I won't repeat what everybody else has said, because I'm absolutely impressed with what the NHS have been trying to do. It's not been easy. And just to let Guy know, I am now on the temporary register. He'll know what I mean. It was done within 48 hours. I cannot believe how quickly they re-registered me. So I was absolutely delighted. So I'm hoping to help with that vaccine rollout. But what I have to say, Anne, is that there is an issue amongst, and I don't think it's just the BAME community, but it seems to be presenting itself in that way. There is some hesitancy in people taking the vaccine. It's distrust because of the disproportionate representation at the early stages. I don't know what it is. And so the question I wanted to ask Sean is, at a combined authority level, are you doing things like frequently asked questions? Are you doing things like pressing the government for more granular data so you can actually see what's going on in different parts of the region, and we can do some joined up focus work? And finally, as the combined authority, how are you adding value to this particular issue? I know you do a great job. You know, I know you do a great job. But for me, it's just to get some focus of where at the moment the combined authority, what exactly are we doing at the combined authority level to just add value? And I'll stop there. Sorry, I'll stop there.
That's super. And Paulette, well done in re-registering. That's you know, a great gift. Thank you for that. I'll come back to Sean for the wrap up on this after I've brought Guy in.
Thank you, Chair. I am conscious that you want us to move on, so I'll try and be quick, but I just thought it might be helpful to give a little bit of an update from the university sector, as it were. So first of all, in terms of our students, with the announcement on the 5th of January, at that stage, most students hadn't returned to their campuses. Anecdotally, I'd say we've probably got between 5 and 10% of students back on campus. Vast majority are all being directed to study fully online, with the exceptions of courses that lead to the health professions registration, which is really important that those do include an element of face-to-face, so that we can get those people to register on their professional registrations and join the workforce for the NHS, which they are also doing, contributing to through clinical placements. The only other thing to say is I think that there was a significant rollout of testing pre-Christmas and since for all students, and I think our universities have contributed to actually delivering on those testing centres in conjunction with their partner local authorities, and we're all encouraging students, indeed insisting that students are tested if they are coming onto campus. Thank you.
Guy, that's very helpful. Thank you. And just to add to the updates, we have a mass testing station due to open on Monday at Stoneleigh Park, which is, for anyone who ever went to the Royal Show, they will remember that. Let's hope it's as much fun as the Royal Show was. So Sean, back to you for one or two questions and comments, I think.
Thank you, Mum, and I'll keep it really quiet because this was supposed to be a 5-minute piece and I'm looking at the clock with 22 minutes. That's my fault, I'm sorry. No. So Anson and Councillor Hamilton, a really good pushback and really important. So we're currently working with leaders across the Chief Exec's group and Director of Public Health to understand where our position is as a combined authority. So I'm really keen that actually working with the Mayor to support him, supporting our businesses. And I know Steve Vincent's put in a bit around the vaccinations bit. So we pushed out to all of our businesses in the region to see whether they can help to support the agenda around vaccination, support around any of that delayed transfer of care work, anything we can do to support the NHS, and that really push it through staff who are furloughed or who have been made redundant, or whichever way we can, or even adding venues or localities. So that's really important. The second bit is actually using the Mayor to support various other elements, actually, such as the faith networks, the community sectors that he has avenues and opportunities to do to really get that message out there. And then finally, from the convener team, so I work in my other part of my job with Clive Wright, who's the regional convener, to think about the test, track and trace, the vaccination space. And I'm trying to therefore be a conduit between the combined authority, the local authorities and the national system to be able to push some of those elements up and being really clear that we start to lobby government for some of those things that we want to change. So we talk about workplaces not being safe. Well, actually, if we did a test to work approach to therefore keep people safe in the workplace, where is the innovation we can do? So we're really trying to plug the gap, but understanding that we don't want to, forgive my language, put tanks on the lawns of the local authorities who own the business, nor of the NHS who have that. We're just trying to find our sweet spot and make sure that we add absolute value to support that message going forward.
That's really helpful. Thank you very much. And I think it's an indication of how important this particular item is that we spent that time, and please forgive me for indulging a little bit. So I'm going to move us back to the agenda proper, and I did, for those of you who were on earlier, I did ask Wendy about those who were not able to be here. So those apologies. Wendy, I think we can take those comments as read, although it was prior to the start of this meeting. Is there any addition to those apologies?
No, Chair, those were as read earlier. Thank you.
Thank you for that. Then I'm going to ask if anyone has any declarations of interest, please. Do put your hand up. I think there may be one or two hands that are historic hands. But Guy or Steve, have you got any? No, they're historic hands. Steve, have you got anything you wanted to?
Yeah, it was just a very quick one, Chair. My apologies, and it's on the previous item, and it was just to say I posted it in the chat there, but I know that they are looking for more volunteers in terms of the vaccination process, because obviously you've already indicated there are numerous, and we're working through St John's at the moment in providing, and we've got well over 400 volunteers there, but I know they're looking for more, especially when there's a push now for 24/7. And I know it was just something, could we as a board consider how we could support encouraging more people with the appropriate qualifications, which doesn't have to be medically qualified, it's minimum of a 2 A levels or equivalent, to undertake the training to support the programme. And it's maybe to take offline, Chair, but I just think it's an important thing to raise.
That's very helpful too, and we all represent our own councils, and so I think many of us will take that back and consider how that's being communicated out to our residents as well. Thank you for bringing that up. So no declarations of interest. Item 3 is the minutes of the last meeting, and I wonder if I can ask for approval of that. I will take that as read unless I hear from anyone to the contrary.
Take as read, Chairman.
Thank you. And any matters arising from those minutes? I see none, so thank you for that. I will move us then on to the Health of the Region report. This is both Ed and Mubashir, I think, but Ed, you're going to kick us off, aren't you, with the report?
Yes, I am, but I'm hoping that Mubashir will share his slides. Is that okay?
It's a double act.
Yes, indeed. And listen, I'll be as quick as I can, because I think the conversation that we've just had was incredibly important, and it wouldn't have been right to have had a wellbeing board at this particular moment in time without having discussed those very urgent and important issues. So but I think we can catch up time for you, Chair, if I'm particularly quick in terms of my comments this morning on the Health of the Region report. It has, after all, been to the Combined Authority Board before now, and indeed the last couple of Wellbeing Board meetings we've talked about the build up to it, if you like. So my slides are mainly about sort of background and context, and the report itself, and Mubashir is going to talk a bit about where we're going in the future. So just some very quick headlines around the background. This was originally commissioned as part of our annual plan as the work that we were going to do, but we suspended it because of COVID and thought we really must look at the impact of COVID on the health of the region, and in particular on Black and minority ethnic communities. So we did that, and through the summer we had a bit of a sort of consultation engagement time with a call for evidence, and we published the report that you can see on the screen now. That has now led through to the Health of the Region report, which was published in November. And it was published really as a counterpart to the State of the Region report, which has a very economic focus. And again, there are conversations now about how we might bring those two things together more effectively. But as much as anything else, we felt it needed to be a call for action. So we actually start to talk to partners and other stakeholders about what we're going to do about the situation. I think some of the Public Health England reports on the impact of COVID, particularly on BAME communities, were criticised because they didn't actually say what we're going to do. So a lot of the focus of this report is on what we're going to do, and in a moment Mubashir will talk about that. If you want to just move on, Mubashir. And why is it important? Well, I don't think anybody in this meeting needs to be persuaded of the importance of looking at health inequalities, but and it's particularly important, I think, the combined authority has a role to play here. I think, obviously NHS partners, directors of public health, local authorities, there are many players in the system who have, if you like, a more direct role in relation to health. But when we talk about health inequalities, the interdependence between health and wealth is actually absolutely crucial, and that's why I think the WMCA have got a critical role working with health partners in the region in order to look at these issues. And so if you want to just flick on to the next slide, maybe share. So this is the kind of infographic that tries to summarize a 100+ page report, and I'm not going to worry about the bottom part of this infographic because Mibsha is going to talk about that. But what the report effectively has shown is represented in the orange boxes at the top, that we have significant health inequalities in the region. Again, I'm assuming people are familiar with that fact, and that the impact of COVID has both exposed the extent of those health inequalities, particularly amongst Black and minority ethnic communities, but also exacerbated them as well. And so I think we're going to be living with more entrenched health inequalities now in the future than we have done to date, in part because of some of the measures that we've had to take around closing down the economy, which will further deepen the problem. So what are we going to do about it? And this is the little 1, 2, 3, 4 boxes in the middle really spell out, if you like, a framework for action, as we've called it in the report. First of all, we've got to focus on improving outcomes for Black and minority ethnic communities. And of course, we've already been talking this morning about vaccination and attitudes towards vaccination and critically access to vaccination. And I think it's very important that we keep these issues of structural racism to the fore when we consider consider even things like the vaccination programme. So that's the first priority, and there are a set of commitments and actions around that Mibsha will talk about. The second area is around tackling the wider determinants of health, the causes of the causes, as we sometimes call them. People's housing situations, people's economic situation, the type of jobs that they're in, and the public transport that they use. So those kind of things are absolutely critical in ensuring that people have the, if you like, right conditions in which they can be healthy. Linked to that is widening access to health and care services, and again, critically important that people can access, as we've been talking about, vaccinations, or indeed hospitals, crucially primary care as well, where there are some really significant differences in the provision of primary care between poorer and richer communities. And I think we're beginning to see some of that play out too in relation to the vaccination programme, which is concerning. But so access to health and care services are important as well. And it's once you've got those other things sorted out that then we can talk about the really exciting stuff around people-powered health and how we can all play a role in changing our health and physical activity and mental health behaviours, if you like, and that will improve our well-being. But I do think the arrows around this diagram are quite important to realise that, very often there's a huge temptation to talk about people-powered health, the ways in which, social prescribing, the things that we can do to improve our own health. But unless we make sure we've got the conditions right, that we're tackling structural racism, that we're tackling those wider determinants of health, our economic and social circumstances, and that people have good access to health and care services, then we're really only sort of scratching the surface of the deeper health inequalities that we face. So if I just stop there and pass on to Mibsha, because the most important thing is to say, well, what are we actually going to do with that analysis?
Brilliant.
Thank you, Ed. So yes, indeed, what we want to focus on today is clearly, what are we doing on the back of publishing the report, and crucially, it depends on a lot of our partners. So we've created a bit of a dissemination plan in terms of how we're going to deal with some of our internal colleagues and how do we get some of those CA commitments progressed, and how we're going to engage with the community through roundtables and with our local health and care system partners. So the next step then is coming through. We have also summarized the report through a video representation to make it easily accessible, and that will be launching next week, along with a social media campaign promoting the report and the commitments that have been put through. The commitments that we've mentioned, obviously there's more than 50 from various partners across the region. I'm not going to go through all of the commitments, but essentially we've shared those before, and we've highlighted some key ones. And now is the time when we actually want to follow through with our partners in terms of how do we implement this, how do we make sure that it is something that we can then feed back to the community through those roundtables. So what are we doing to engage with those partners then is, so we've identified key aspects of the report that link to that particular organization, and then we're trying to remind them of the commitments that have been made and working on an action plan with them to see how we can take that forward. So, for example, with the West Midlands Police, we've put across some key findings from the report so that they don't have to sift through the whole report, and then the commitments that they've made are the ones that we'd like to work like to form the basis of our future partnership with them. Similarly, with the Homelessness Task Force, it's a similar approach. Again, I think there are various aspects of the report that link up with them, but we've highlighted only the ones that are potentially can be used to take us forward. And the similar thing with the STAR board. And what we are trying to do here is not reinvent the wheel and only work forward in terms of there's already a lot of hard work being done by partners on inequalities and on some of these topics. And what we want to do is bring it together and bring it to light. So we're going to have a partner from the STAR board come through later. I'm going to introduce her, and she's going to talk a little bit about some of these outputs. And that's one way in terms of how we're engaging and trying to make sure that things that have been stated in the report are actually followed through. Yeah. The other thing that we're trying to do, obviously, is in order to keep track of all of the commitments and the work that's happening and the meetings that we have and any follow-up things that we need to do, is we've created a Trello board, and this will then be shared with our partners so that it is a live document that can be updated by them and for us, and we are working collaboratively in this time period when we're not able to meet up face to face. We can do this virtually. So this is just one example of how we're going to try and make sure we progress. It is still in development. As you can see, we've populated these boards by each of the 4 priority areas, and we've outlined all of the different commitments that each of the partners have made. We've categorized them by the organization and trying to make it as easy and as usable as possible. The other thing that we potentially could do, again, working on the theme of utilizing products and things that we've done before. As the board knows, there was a bit of work that was done around developing dashboards in conjunction with Public Health England West Midlands. And what we want to try and do is to check if there's a long-term impact based on the work from the commitments, and track those by the data that gets submitted through the Fingertips website. Now, this can work as a monitoring mechanism, and we can review this at the board. But this is an item that I think we can discuss as a board in terms of if this is a use a useful way of utilizing the dashboards. And we're going to have Lena Martino come in and talk a little bit more about these as well. So as promised, what I want to do is focus on some of the key work that we're doing post the report. And for that, we brought in partners to talk a little bit about some of the work that's happening. So we're going to have Rebecca Farmer talk about the toolkit that has been produced by the Inequalities Working Group of the STAR Board. We're going to have Sean talk about how we're progressing work on BAME Thrive. And we're going to have Simon talk about how we're trying to influence preventative services with our public health teams, and then we'll have Lena discuss the dashboards. And if there is time, Chair, at the end, we can have a discussion about how best to use those dashboards going forward. So if I can have Rebecca join us.
Thank you very much. Shall we go through them first before we pick up general comments about the report? Would that be the best way to do it, Mubashir? Do you think?
I think it would be useful to see.
Yeah,
well,
to hear them.
Yes, absolutely.
So we'll do that. So lovely, Rebecca. You're going to give us a little bit of a view on the STAR board, I think. Are you there?
I am here, yes. And just to remind you, I'm also your NHSEI rep on this Health and Wellbeing Board, but also I've been supporting Danielle Oom, who has been chairing our Strategic Transformation Working Group on Health Inequalities, which NHS Midlands set up, but with partners from PHE. It's got local government, DPH representation, and then leadership from within the NHS. And just by way of context, it was set up as a task and finish group to develop tools and best practice to really make a change in terms of health inequalities, and is part of a wider suite of strategic work that we're doing within NHS Midlands. So what you've got in the papers is actually the first phase output from our work, and it's effectively advice and guidance for systems on accountability framework for health inequalities, best practice in terms of planning for health inequalities, roles and responsibilities of partners, and then a draft, what we call a charter or MOU, on everyone's commitments to health inequalities. Just for context, though, the other work, which will be phase 2 outputs, that is underway and will come later on, hopefully before the end of March, though, it will be more specific around decision making around health inequalities interventions, particularly in terms of regional prevention programmes, and evaluating kind of lessons and making decisions in the light of the post-COVID and Black Lives Matters learning. And then we're also doing our own work, and we've commissioned some external support on a health inequalities dashboard, but orientated on the data that we have currently NHS and the partners and things. So hopefully that might align quite nicely to what Mubashir was saying around the dashboard work you'll be looking at as well. And we can always come back to that at a later time, if that's helpful. So just to focus on the report itself, what you've got is a final draft version of an output that we aim to provide to our systems over the next few weeks. It does need some final case studies adding to it. It also needs to be designed and branded appropriately, but we thought it was appropriate to bring it here in case there's any particular comments in terms of the content, but also we'll be working up a bit of an engagement plan in terms of how we then share it with our NHS stakeholders and more widely. So also invite any comments on that aspect as well. And I think that's probably enough from me for this. Thank you.
Thank you very much, Rebecca, for explaining how you're presenting it within your organisations too. So shall we move on, Sean, to you? And I think you're going to give us a little bit of an update on the additional investment on BAME Thrive.
Thank you, Ma'am. So I think for me, it's really important that we recognise that actually through the ARHIC report that the implications for us is that we need to tackle that structural racism that's inherent within the workplace, and that gives us a really good opportunity to develop our Thrive at Work programme and making sure that then we flow a new model going forward. So what we're intending to do is actually to develop a piece of work that really focuses in line with the Advancing Mental Health Equality framework that was developed by Dr. Jackie Dyer, who did some amazing work with the NHS around mental health equality. And really what we want to try and do then is actually think about the toolkit then to move this agenda forward for people who come from our Black and minority ethnic communities. I think for me, the first bit is around making sure that we get our language right, because I think it's so important, but also that making sure that actually we give the tools to businesses and employers to really support that agenda. So a really recent report has been delivered by the City Mental Health Alliance. So the chair of that and the chief exec now actually is Poppy Jaman, who was the chief exec of Mental Health First Aid England, and she's moved herself out now to the City Mental Health Alliance and doing some amazing work both nationally and internationally now. But just started to think about what the academic research is telling us, that actually people from the Black and minority ethnic background generally experience greater psychological distress and receive poorer quality of care. We do know that actually 38% of Black and minority ethnic respondents said they'd experienced racism in the workplace. We think that, or we know that actually 61% of Black and Caribbean and 63% of mixed race and 65% of Black African people felt they were treated with less courtesy than others because of their ethnicity. And we do know that through lockdown, the work that's been undertaken by COOTH, which is the NHS Young Person's Online Support for Mental Health Toolkit, says people for children from young Black and minority ethnic communities are disproportionately affected through March to June lockdown. So what we're planning to do, therefore, is to review our Thrive at Work programme with a lens around the communities who come from the Black and minority ethnic communities, to really think about actually how we work that into a space that's really offering a very strong, robust toolkit then to businesses. To help tackle some of that structural racism that's within the environment, but also to create the conditions for organisations to be healthy and help reduce some of those health inequalities that Ed and Rubisher have mentioned through the report so far. We're hoping that then that will flow over the next few months, and then we'll be coming hopefully back to you in sometime in July with a toolkit that's been refreshed and revitalised, ready to move that forward. And to do that, we'll be setting up a variety of different frameworks to have people from the lived experience, but also from the anchor organisations to support that piece of work. And that then will also drive into the Midlands Engine work that I know Guy is very supportive of through the MHPP programme as the lead investigator, and that will then flow through the Midlands Engine footprint too. So our reach then will not only be for the combined authority footprint, but amplified across the Midlands Engine, which hopefully will be a really strong position for us going forward.
Thank you, Sean, very much for that update. And then we've got Simon. You're going to give a point of view on the physical activities, lifestyle scoping. Simon, are you there?
Yes, I am. I'm going to do this verbal report. We can share the slides go out with the papers. The Health and Region report give us that really strong evidence that says the West Midlands more likely than England average population to smoke, drink too much alcohol, be overweight or obese. And we do know already through our work with partners around that levels of physical inactivity. But that's again set in the context of the national figures are already high. And we know we're paying a lot of attention around our West Midlands performance against national figures, but there are those really worrying signs that unhealthy lifestyles across the UK are very common, and improvements need to take place and be considered across the board. We've been analysing and looking at the data within the health of the region to see how the West Midlands perform against England average. And we know against the scale and the issue within the challenges around those lifestyle factors, that the West Midlands constantly performs far worse than an England average. But there is some great work in our system that we're really beginning to learn and understand and experience. We know that in most local authorities, given COVID and contracts, there is a review of services. And we've had some initial conversations with our local authority partners, NHS and others, and saying, is there some space that the CA could support and add value to this work? But that's really clear and set in the context of the CA functions, what it's doing, what it's able to enable, what we're able to influence, and what we're able to negotiate with partners, both locally and up through nationally. Not get involved in delivery unless there is that a mutual agreed logic that we do so. And where could we have some influence and some opportunity within our own system and the CA to influence change? What we're seeking from today is just here's some of our early thoughts of what we could do, and whether there is support to enable us to take this forward and work up that joint commitment to action around lifestyle factors in the region. Against the response from our local authorities, there's an opportunity to convene, to be a convener, to bring our lifestyle leads together, to share practice and then plans to review services. What we're learning, what's it begin to tell us? What's making a difference? What are some of those wider determinants? What impact is it having on our BME and vulnerable communities? Where could we see if there's some added value? How can we begin to look at some of the existing policy and practice? What are we learning from Thrive at Work around lifestyle factors? How could we revisit the health and transport strategy that we developed jointly with Transport for West Midlands about 4 years ago to begin to make that real relevant to the challenges we're facing through and the health of the region? How can we work with our partners, particularly looking around and making every contact count, to really interpret the model of that lifestyle care pathway and its impact on BME communities? And that will supplement the work we're doing around with the system to try and reduce levels of inactivity and inequalities that they take part, and that opportunity to champion the Commonwealth Games legacy. What we're seeking more than anything from today is that opportunity through the board to begin to see if we can have those permissions to enter those conversations and draw together some of that thinking about where we could go within those lifestyle factors. Really conscious that we're not around delivery. This is about complementary and added values that we can provide to the system. Thank you, Chair.
Brilliant. Thank you very much, Simon. And the last to present on this particular item is going to be Lena. And Lena, do you want to come in now? Thank you. There you are.
Thank you, Chair. So in July, the work plan for the Population Health Intelligence Hub that was agreed by the Wellbeing Board was modified and adapted to take into account the need to prioritise the regional health impacts of COVID work that Ed and Mubashir have just described. But if you'll recall from that, we did agree that there were some key projects that we wanted to retain because they would support improving how we work together as a system, and other elements of that work plan, including the Black Thrive initiative, which Sean has just described, have actually been integrated into the regional health impact of COVID commitments and follow-up. So in particular, I'd like to just pick up on the Wellbeing Board dashboard that Mubashir briefly introduced, which some of you will remember that Rob Davis presented in October. And just as a recap, this is a set of indicators hosted on the PHE Fingertips dashboard, specifically for the combined authority, and it's grouped into key programme areas, including Thrive into Work, housing and homelessness, environment, etc. So there are various, I think there are about 9 of them. And what this does is it shows how each programme area contributes to improving particular health and wellbeing outcomes for the region over the longer term. And if you'll recall, Rob used logic models to show how, based on the evidence, the investments made and the outputs generated are going to lead to those improvements. And that can help us to monitor and inform progress against the commitments that have been made. I think it's really important to highlight that it is not a performance management tool, it's not a contract monitoring tool, and we're not using this to hold programme leads to account for particular health outcomes, because as we all know, each health outcome can be influenced by a myriad of factors across the system. So really it's to identify where can we work better in partnership, both internally across the work streams, but also externally with partners and stakeholders, to start thinking about how to reduce those persisting inequalities in the region. And it can also help to start embedding a health in all policies approach across the combined authority, which Rob also talked about. So I'd be very happy to answer any questions on this particular area if anybody has any.
Thank you. Right, so the discussion, I'm very conscious we've had a lot of people talking to us, and now is the time for us to comment on those. And so we've rolled the two items together, obviously the health of the region report, and this last bit with the presentations from Rebecca, Sean, Simon and Lena is our partners' engagement in the health of the region report and how they are progressing that report and actioning it. So the questions and the commentary is now for members to put forward on the presentations we've had. And I wonder if I might open this up and see if there is anyone who wants to come in at this point in time. And this is on both items, of course, as well, one, the report, and two, the actions. I think I would actually just like to start off by saying a thank you in particular to our health colleagues for how they've taken this forward and how they're embedding this. And it is, you know, it's at a time of crisis and a time that's particularly of concern, but actually that was what triggered the essence of the report in the first place, and in particular so how we in the first wave had identified the impact of COVID on the BAME community and why and what has brought that about. It's be interesting to know if work like this is being carried on wider than this region in other areas. And you know, Ed Mubashir, you may well know of that and comment on it. Could you let me know if you have?
I think what's interesting, Councillor Seckham, is that I think our work is pioneering in the sense of the focus and the collaborative approach that we're taking around health inequalities, and indeed the work that Rebecca's talked about as well. So much so that, but I don't think it's completely unique. But what we do know is that the M9 group, the different combined authorities, mayoral combined authorities around England, have now or are now beginning some work to do some comparison between the different areas, and in particular focusing on Greater Manchester, West Midlands and London, around what we're each doing in how we tackle health inequalities. So I believe we're going to have a secondment working with our team as part of that work to look particularly at how that develops, which is going to be really interesting actually to see what A, we've got to offer, and B, we can learn from other areas.
I agree. I think you know, to overlay those pieces of work will be fantastically interesting. So thank you. Anyone else got any comments at this point? I noticed guys just had to pop out and take a call. Karen.
Thank you, Chair. A few areas I just want to pick up on. First of all, the actual health of the region report itself. Now, reading through the report, I want to pick up on where something has been accredited and how it's been accredited to a political party. I don't believe this document should be political. as it's a, it's talking about the region and not certain parties. So I just wonder how that's come about being in the report, and if it is actually a report of that particular party, or is it of a council, or how that has happened. So that's my first point. My second point is around the programmes and the updates and everything you've just talked about. And there's a lot of work going on in terms of health inequalities in different areas. So it really is about how we bring that work together, and a sort of that question of subsidiarity. Ultimately, councils are responsible for delivering that public health agenda, and even sitting around this table right now, I don't think we've got all the parties that should be together. So you talk about, I know you talk about getting the 7 authorities together. So we really need to be having our public health directors fully involved in all of this work. I'm glad you mentioned Rob Davies, Nina, because actually Rob now works at Solihull Council, and he is leading on our health inequalities strategy. So I'm just really wondering how other authorities are now going to develop their strategies as well, and how we bring all of that work together. The other point I wanted to make is some of the examples you have set are from other areas. So talking about the rough sleepers, for instance, in Nottingham, that is great. But I'd like to see the good examples of what we're doing in this area, because I was on a homelessness task force yesterday, and there is good things coming out. So, around housing first and that sort of thing. So should we be putting those, or should we put them in a different section? So I want to see more good examples from across the region.
Thank you very much, Karen. I'll get them to come in. Actually, I think that last point is a particularly interesting one, because it's an area that has had a great deal of investment and activity through COVID, and it would be very helpful for us to see how that's been rolled out, what the benefit is, and how, now that we have got homeless largely off the street, we might be able to address some of those health problems that they particularly have. So I think that is a specific area that it would be better to have our own picture of events, rather than perhaps other areas. So who am I going to? Mubashir, Ed, on Karen's point?
I'll pick up the political point, Councillor Second, and then Mubashir will pick up the other point. So just on the question, Councillor Grinsell, I think you're referring to the fact that on page 56 of the report, there's a reference to something that is referred to as the Labour Party piece. I just want to be clear that that is a report that was produced by a steering group, a wider steering group. It was co-chaired, including by our own Councillor Hamilton, and it was on the wider impact of COVID, the West Midlands impact of COVID-19 on BAME communities. I think, it was an excellent report, I should say that, and it was a non-political report as well, and that's explicit in the report. And I think that we have incorrectly attributed it in this Health of the Region report. We've given it the wrong title, and I think we can make that change to the online report going forward. So that won't be so it won't be referred to in that context, I think.
And I think it's referred to in another section, page 111 as well. Okay. So, and I just want to absolutely say that Councillor Hamilton chaired a brilliant health and wellbeing board around this subject. So I just want to make that point too. Thank you.
Sure. Yeah. Sure. Yeah. So we can make those small corrections to the report so that it's given its proper title.
Thank you, Ed, and Mubashir on the other points.
Yes, thank you. So absolutely, your point about collaborating with the key partners in the health sector. Obviously, the directors of public health are key in this. I think we have engaged with them quite well. We've gone to their regional meetings, and they are fully on board in supporting some of the work that we're going to be doing. I think what we're also clear about, as you can see from the commitments, is about acknowledging some of the great work that the partners are doing already and what they plan on doing going forward. And what we would like to do is use this as a vehicle to engage with them further and see how we can add value to their implementation. So the directors of public health are very much on board, and I do catch up with them regularly and use the Health of the Region report work as the basis of taking forward all the work that we're going to be doing. What you don't see explicitly stated within the report as a commitment from the directors of public health is, what they're going to be doing, and the reason for that is because everything basically that we've said in the report is part of their everyday work, and as such, it would have been a line that said they're going to carry on doing everything that they can on inequalities. So. In summary, yes, we are engaging with them. They're very much involved. They haven't been explicitly stated here, but we are taking that forward. Ruth was here earlier as the regional lead for the DSPH for the West Midlands region, and we usually have representation from the DSPH here. On the other point, I believe it was about I think the homelessness task force and highlighting some of the good work that's been happening. I think within the report itself, we have really good examples of some of the work and the outputs that have been produced by the task force. I think the slide just took out a few points there, but certainly going forward, we're going to be bringing back some of the amazing work that task force is doing going forward. And I think there's 16 different case studies that we've mentioned between pages 79 to onwards, and the next 10 pages around that. So I think there's a large portion of the report that focuses on that already.
Thank you. Thank you. Yes.
Did I miss anything on there, Chair? I think I addressed all of the questions.
Yeah.
Anything you want to come back on, Karen?
Yeah, and that's what I suppose I'd say, that question of subsidiarity. You've got ICSs being formed, you've got frameworks there, you've got Wellbeing boards. So it's how this is linked, and ultimately where the responsibility lies, I suppose.
And I guess the challenge on that, there is a challenge in that. Part of the challenge will be partnerships are very difficult. They are about, excuse me. They're about relationships, trust, and a joint endeavour. As such, that we tread a fine line between mandating and engagement on a joint journey, and that I think is always going to be one of the challenges for that. But you raise important points, I think. Ed, thank you for noting the examples, the West Midlands examples too, which are within the report. I haven't got any more, but can I just say a huge thank you, because it is a joint endeavour and it is a partnership piece of work. So I think what's important about that is, how we take it forward and how we see the benefit of that coming out. It will be years of work rather than a quick fix, and ultimately what we're trying to do is uplift the inequalities and try to address, make this region somewhere that's really cracked that issue. That would be our goal. It's ultimately to the benefit of all our residents, and I think, as you said very early on, Ed, we cannot take this particular report out of the State of the Region report. The two are integral, and of course, many of us will all say one of the best things we can help our residents to do is find a good job, afford the house over the head, warm heating through the winter, which will help their well-being, will help their outcomes. And that has to sit neatly with the State of the Region report. So it's understanding that nothing is an island on its own. Thank you all very much for your input on this, and for the good work that's jointly going on across the area. I'm going to move us on to the working together agenda item, and Simon and Deborah, I think you're going to take this forward, which is the active travel and health report.
Yes, thank you, Chair. We'll keep this relatively brief, but we do have a short slide presentation we want to go through. We know how important that everyday exercise is for us, particularly that opportunity to go for a walk or go for a cycle. And we do know for the many of our communities who are reliant on walking or cycling to get around, to undertake their everyday business. And also, what we're learning through lockdown is many people who were previously inactive, were not using active travel, are beginning to do more during this stage. And I can't thank enough the work of local authority and other partners, transport teams and health and wellbeing teams, who've worked very quickly to turn around the opportunity, to turn around things, to enable them to be greater opportunities and opportunities for people to walk and cycle. And that's about making it more enjoyable, about making it more accessible and inclusive. And that's about making it safer and easier to get around. Led by the TFWM with our transport colleagues and with our health colleagues, both at local and regional level, we're now delivering the tranche 2 of the West Midlands Active Travel Fund. And Deborah and myself just want to pick out some of the things we've learned, some of the things that we are doing, and the impact and opportunity this has to address some of the priorities within the health of the region. So I have the luxury of passing over to Deborah, who's going to share her screen, because from bitter experience, we know that doesn't work very well with me. So.
Thanks so much, Simon. And yes, I'm Deborah Fox. I'm the Head of Demand Management in the Network Resilience Directorate Transport for West Midlands. And my usual day-to-day work is helping people to keep moving on the transport network around the significant investment that's going on and the associated construction work. So to do some work on enabling people to walk and cycle and get all the positive benefits out of that has been a real pleasure for me. And we've got some fantastic stories to share with you today as well. So just go through a few slides, and there'll be a chance obviously to circulate these afterwards for you to look at in more detail. But just to set a little bit of background and context to this, so throughout the pandemic, there's been real signs that people have taken to being outdoors more, and not only through necessity, but also for the benefits of walking and cycling and experiencing nature. And the government responded to that in May last year with a £225 million emergency active travel fund. And its aims were not only to enable sort of short-term and COVID-related social distancing outdoors, but also to deliver long-term health, environmental and congestion benefits. And we've really taken that to our hearts. The West Midlands indicative allocation was £17.2 million, but I can assure you that we had to put together a concerted effort not only to define a large number of short and longer term infrastructure schemes, but also a package of supporting measures that I'll go on and talk about in a moment. And this is an intense collaboration for us. We haven't had anything like this, certainly on the behavioural change side, since about 2016, when the local Sustainable Transport Fund ended. So, I'm here to talk to you today, but the accountable officer is Claire Williams in the cycling walking team. We work very, very closely with Simon, and obviously the local authorities are delivering the infrastructure schemes themselves. So this is a huge partnership, and we're really learning to work closely together on it, so that when future rounds of funding come along, a lot of the things that we were able to pilot, especially last year, can really be embedded and ramped up and rolled out wider. So just to give you a flavour, in the first tranche, which was July to September last year, there was work on low traffic areas, especially in Birmingham, There were cycling and walking improvements and pop-up cycle lanes. And my goodness, it would take me 2 hours to talk to you just about some of those successes. But I just picked out 2 slides from a big pack, and they were pop-up cycle lanes in Selly Oak and Small Heath in Birmingham, and some of the renewed cycling infrastructure schemes in Walsall. And that included the provision of cycling racks, which you can see here, really good quality sort of supporting infrastructure that make people want to use their outdoor environment and feel their bikes are safe as well as themselves. So the bit that's got me really energised is the people bit. This is about improving people's health and well-being and active travel. And so I just picked out a few successes from the last year of July to September. 103 organisations took part in Cycle September, and there were 141,000 cycle miles made and logged on Love to Ride, which is a new West Midlands platform. There was the cycle parking scheme was launched, and we had over 260 subscriptions. And as far as I know, all of those are installed now, so people can store their bikes safely. 269 people took to our parks to join in Midland Mencat Park Ride. We work closely with cycling partners. One statistic that sticks out was 185 bikes were made roadworthy in Wolverhampton. And then also 5 travel planners were embedded in the local authorities to work really intensively with 50 businesses and universities with a reach of about 90,000 employees and students. So we consider that quite a small start, but that's just to give you a flavour of what's to come. So the second tranche was announced in mid-November with £13.1 million announced. There are new consultation requirements, and very specifically, all local authorities were required to produce a consultation plan ahead of receipt of funding. And I think this reflects that at the time, back in July to September, there were, some concerns from local communities, and rightly so, and they may have bubbled up to ward members and to cabinet members, and so you may have live experience of that. So we want to do this sensitively, working really closely with communities and making businesses aware of the opportunities and also some of the challenges of installing that infrastructure. This is moving on into tranche 2. So you can, if you spotted the first map, you see that the colours have slightly changed here. There's a real ramping up of the Places for People programme in Birmingham, which is around low traffic areas. And there's also these purple pop-up cycle lanes that are radiating out like bicycle spokes out from Birmingham into areas that will feed into the city centre. There's some fantastic local centre improvements that are underway, and there's some connecting infrastructure, really key infrastructure, for example, in Coventry and Solihull and up in the Black Country that will connect existing cycle lanes and routes. So what we started in July to September last year with businesses, with communities and with schools, we're now really ramping up as we go forward, and this will continue till the end of March 2022. So for once, government has given us a much longer period for delivery, although the infrastructure schemes must be very sort of mature in their designs and sort of at least ready to go on the ground by the end of March. And one of the things I find has really sort of taken us into the next generation of engaging people in this sort of activity is that we're really able, through automation, to capture stories. And the West Midlands Love to Ride platform has been a bit of a revelation, really. So many people have wanted to log their rides. You can also identify associated carbon dioxide reductions with those rides. And we've just had the Winter Wheelers campaign, which is all conducted online and attracted 90 organisations over November and December to take part. So you can see on screen there one of the lovely quotes that people put on there, but I will just read out the second part of it. It's much more than just a bicycle. It's a lifeline for me. The only thing that works for me when I need to clear my head and settle my anxiety is to ride my bike. Powerful words indeed. So, Simon, we've also got some really exciting projects, haven't we, that really work closely with disabled people, in particular, in enhancing what we did in round 1 with Midland Mancap and so on, and really taking that to the next level.
Yes, that next level is about how do we really make that long-term behaviour change, and particularly to ensure that our walking and cycling infrastructure is more accessible and more enjoyable to use by our disabled citizens. And that's the key part of this Midland MenCap work, going from that pop-up events, taking forward that learning and make this about everyday behaviour.
Absolutely.
Our social prescribing work, we do continue to have this ambition to be a social prescribing walking and cycling region. And we've learned a lot through our Black Country work, whereby we're targeting patients with hypertension who are identified as being pre-diabetic, people from recent migrant communities. And what we've learned from that is that it led to 93% of the people taking part realising health benefits, 76% continuing their activity, giving them opportunity to get bikes and other equipment to improve their health. What we've learned is about how people who are relatively new to walking and cycling have an issue and a challenge around pain, which we're looking to explore. We're now taking that across the 10 priority wards in Birmingham, and we want to take that learning to enable us to fill in the gap, to share that learning with Coventry and Solihull, so we begin to have a greater impact. I know Councillor Grinsell's raised about the appetite around Love Exploring. That is really making a difference in the Black Country. We think the figures now, around 8,000 people are using local parks in the Black Country, using the Love Explore app. Outside this funding, we're looking to see how we can attract additional funding to extend that work across the region. Back to you, Deborah.
Much, Simon. And one of the things we've been able to do since the programme began last year is really to bolster the activity of cycling walking partners that are already in the region working with us. They're targeting hard to reach groups. The Dr. Bike style measures were really successful last year for those with a bike to be able to take it to public locations outdoors and have them fixed and get advice on how to use them, and also bike security marking. And government has nationally funded a couple of those partners to deliver national services, which will be rolled out in the region. One of the things I'm particularly interested in is the support for primary and preschool age children to walk to school by the Living Streets WOW project. And that's already active in the region, but through this funding, we're able to bolster that and reach more settings. And whilst schools are closed to the majority of pupils at the moment, we are actually doing work behind the scenes, offering travel planning to schools to enable them to walk and cycle where possible when things resume. So locking in those really positive behaviours way beyond the pandemic. So some of the core work that my team does is around working with businesses, and this is a fantastic way to use the Active Travel Fund to intensify that. We had about 53 businesses, as I mentioned, in the first tranche, and that will ramp up again this year. A lot of those were in Birmingham, some in Sandwell and Dudley and Coventry and Solihull, Wolverhampton and Walsall, so there's 53 altogether. But I just had one little case study, if you don't mind me sharing with you, that I thought was really nice, because sometimes we forget behind the numbers that there are, businesses, people, schools and so on that really do value our support. So CHEP has 1,500 employees at its plant in Marston Green in Birmingham. They benefited from the travel planning in 2020, which they felt was useful. They received the Cycling UK and the British Cycling support in the first tranche, and they felt it was well advertised. And they saw an estimated 11 to 20% increase in walking and cycling levels in their employees. And now what they want to do is address road safety and road awareness in their employees. So there's more than just a quick intervention. This really does sort of roll on into a legacy as well. Very quick mention for road safety. My director in particular, Anne Shaw, recognises that road safety is a really key aspect of people wanting to take up active travel. So we're working closely with West Midlands Police and the Fire Service to put together a close pass campaign, most likely in the autumn months. and also a pilot to help disabled people to be more mobile and connected. This is about making 20 to 25 bikes available to disabled people. And there's some really phenomenal work going on behind the scenes in order to get that up and running and to coordinate it. So finally, we didn't want to forget that our communities are also wanting support. So whilst we're rolling out all these wonderful events, that does need brokering at a very micro community level. So we are looking to work with local providers to get all of the supporting measures brokered to communities that really most need our help. And we're working with local authorities at the moment to identify those priority wards nearby to their new infrastructure where that is most keenly going to be valuable. And I just wanted to end on this slide because I think this for me really captures what this is all about. Infrastructure is incredibly important. We can't enable people to walk and cycle without it. But it's really the stories that come from people themselves that really inspire us and keep us going and make us want to do more. And I find this very satisfying in my working life. So this is a disabled 61-year-old man in Walsall who has logged his rides on Love to Ride. And, we just see here jumping off the page that he was overwhelmed with joy and satisfaction that he could do a 30-mile ride in his locality. He was able to interact with people. He got support from charities to buy a pedal assist system and also from the health service to enable him to accommodate all of his underlying health conditions. And he says, I'm sure others can cycle on normal cycles. And so, just find that really, really inspiring. So that's all for me. Happy to provide my contact details, but also all of the content around individual schemes, what's happening in the programme is on the West Midlands Commonplace platform, which is signposted below, to our campaign pages on Roll and Stroll, and also Love to Ride, which I've highlighted before. So I think in conclusion, what Simon and I are really looking for is, the opportunity to bolster physical activity with you, to come back and share those stories and maybe some of the challenges that we found along the way. Also, really to seek your help and support to promote these active travel measures that are popping up in local areas and really help to get your wards ready for when they are rolled out. And then, Simon, I think you had another one as well, didn't you?
Yeah. Key for this is how do we work more closely with the health system, particularly NHS and CCGs, because this is a golden moment for walking and cycling as part of your everyday exercise. We really thank you and invite comments.
Thank you very much. Yeah. So thank you both. That's really helpful. There's actually a couple that's I'm going to start it off with just a thought. There was a really interesting programme this week, and I don't know if anyone watched it. It was with Alex Scott and Dr. Tanya Byron about the benefits to depression of activity, and I think they touched on the social prescribing and how in I can't remember which area it was, one of the areas in London. I do advise anyone on Catch Up to watch it. It was called The Truth About, and it was on something like Wednesday night, one of the nights I had free and was able to have a little bit of television time, but it really was very, very interesting, and absolutely the benefits that it has to health, which actually works exactly to your last question. So if we're going to come out of this with a lot of mental health issues, which we do believe there may well be a lot of uncaptured data yet, this is an area that we can work on, and that might give you some ideas. And the other question that I'm going to leave hanging, because you'll come back after other people, the work you're doing around schools, working with schools. How are you also working with the local authorities on their travel plans too, which is very important because, you know, they need to link rather than be separate. But I'll leave that hanging, and I'll invite others to come to put their hands up and ask any questions. And I see Karen reaching for the button, and I think she's about to come in.
Yeah, I will. Because some of what Simon said, you know, I'm really keen on this walking and cycling. I'm not a cyclist myself, but I do particularly want to pick up on that walking. And I think we've talked here before about how we embed that daily exercise in the future, and that, you know, that is the biggest challenge for us, isn't it? Because I think that program you were talking about was sort of saying to people, you don't have to be a marathon runner. You can just literally do a couple of minutes exercise per day would make an enormous difference. And then obviously you build that up over time, don't you? So it's about how we try and get people to embed their day. But what are the barriers? What are the barriers to cycling and walking? I'm particularly starting to think about pavements where you walk. I run and I walk, but it's higgledy-piggledy, you know. So it's some of the work that the CA does, but then of course, as Izzy says, what the council can do in their area. So it's linking all of that. I think I might have talked about our school street program before, and that's with the school programs that you're doing. My question really on top of that is about low traffic areas, and this is tranche 2, but people have got to apply by March. Is that what you said? I know it's going on to March 2022, so I'm just thinking about the sequencing and the timing of this. People still got the ability to bid in, or is that closed for now and we wait for tranche 3?
May I come in on that?
Both her and me, I think.
Definitely. So the money has been fully allocated. The bid was last autumn, and all of the local authorities have selected their schemes based on deliverability, and also where they know that there is a support from their local communities. The thing that's open at the moment is their consultation plans, and these are on the Commonplace platform. So if you just Googled West Midlands Roll and Stroll and went through the link that says what's happening in my area, it should take you to a dedicated page, and that will tell you what's going on and what consultations are open. But the local authorities are leading on the scheme implementation and on the engagement of local people. We work very, very closely hand in hand between TFWM and the local authorities on this. I was talking to the lead officer on the low traffic neighbourhoods this morning at 9 o'clock. He was telling me all about the opportunities, but also the concerns sometimes there are in low traffic neighbourhoods, and the hard work that he is doing to work collaboratively with people at a ground level to really enable people to get on board. And the anecdotal feedback from that about how something like closing off a street was originally challenging, but now people have learnt to love it and really got with it and recognise that they're sort of getting healthier as a result. So
not really everyone, I will say that, not everyone.
No, but there are some good news stories. But with all these things comes tension.
But also,
Karen, back to you.
You can implement that in areas where there are existing problems. So you look at it as a whole. It could actually have multiple benefits. It's not just the health side. It's speeding traffic.
Absolutely.
Another problem. Or antisocial behaviour. That's the thing.
I'm going to ask if there's anyone else who wants to come in and ask questions or make a comment actually about it, or pick up what you're doing in your area. Lola.
Thank you, Chair. Deborah and Simon, thank you so much for that presentation. It's really heartening to hear how we are making use of this fabulous opportunity. I just wanted to come back to sort of the more immediate challenges of COVID, mental health, lockdown, and particularly picking up our earlier conversation about BAME communities. I was just interested in how we are reaching out, working with faith communities and using that sector to mobilize. We know from other statistics that parts of the BAME community are not as active as we perhaps would want them to be. And we also are aware of the sort of inequalities around mental health. I'd be very keen to understand, how we are also addressing that using physical activity and active travel.
Over to you.
Deborah, very much so. And we're very keen to learn through this practice, this delivery, in terms of the consultation with the communities. That bolstering community capacity funding is really critical, and particularly in terms of most disadvantaged communities. B, in terms of the output data that we collect from every single scheme, are we begin to make a difference to those populations? And what it begins to tell us, what does this work begin to tell us that we need to do moving forward? The mobilisation of transport and health systems and communities to get this funding on the off the ground, secured, and delivery has been critical. It's the key bit now, Lola, is how do we begin to learn what impact we're having on those communities you're referring to is going to be crucial in terms of what we do moving forward.
Okay, can I thank you both for a really interesting presentation, and it is good to know what you're doing, and I hope very much that we're going to see further uptake. It's not just good for your physical well-being, it's undoubtedly good for mental well-being, and it's very good for the planet, trying to get people off the roads and and enjoying activity and trying to make this part of your everyday life. I have to say, I'm not probably need to find more time in my day to get out and do that, but if only there weren't so many meetings. So there we go. Ought to be my New Year resolution. Right.
Thank you so much, Lizzie. I really appreciated the invitation, and thanks everyone for your positive comments and questions. Thank you.
Super. Well, great. Thank you. Thank you all. Right, time is ticking by. We've got a presentation from Simon on the Commonwealth Games legacy, and then we've got one more major item and just a little bit of any other business after that. So if we can move swiftly on, Simon, to you.
I most definitely will be swift. This is a verbal update on where we are on Commonwealth Games. It's important because when we discussed last time in terms of physical activity priorities, Commonwealth Games, physical activity was one of those key points we're driving on. Can't thank again the system enough in terms of how we're working together, and I'm so grateful for the work championed around delivery of the games itself. The legacy is built around 5 pillars: bringing people together, helping the region to grow and succeed, put us on the map, and to use the games as catalysts for change and improve health and well-being. That's really important in terms of what we're trying to do around physical activity with the City Council, with DCMS, with Sport England, and with the whole sport and physical activity system. We will really want to use the games as that catalyst for change to reduce those levels of inactivity and inequalities that exist. We recognise there's a real lot of good work going on at the moment in which we want to build, and our focus has been about bringing the system together around five themes. Active environments. How do we create those new opportunities and block those things that we've just talking through about those streets, parks and spaces for people to get active? How are we going to instigate and build on the work we're doing around walking and cycling? Create those opportunities and that inspiration for children and young people that the games can bring. Harness and galvanise and grow that workforce, and particularly the volunteer workforce that we need to champion that legacy. And ensure there is a physical, the venue legacy. And we make the most of that, of not in terms of just in terms of supporting talent, but also making difference to communities. We're at a critical stage of developing concrete proposals, now in line with the game's launch timetable. And this is about developing and securing funding. It's about consulting with local authorities and others in terms of what role they will be able to play. It's about working together on that leadership journey to ensure that what is left in the region after the game's vehicle has left is a long-term legacy for physical activity. It's about really making a difference and working alongside our communities to enable us to deliver change. We're really confident that over the next couple of months, we'll be able to really sharpen up those proposals, develop and secure that funding, and bring back to you in terms of that sea change that we'll see through physical activity legacy as part of the Commonwealth Games. Thank you.
Struggling to find my button there. Thank you very much, Simon, for that little update. And I'm just looking to see if anyone wants to come in on it, if there's any questions to you on it. I'm sure this will be one of our ongoing agendas, actually, and I think you will. I'm sure you will be probably updating as we progress towards the games on what the benefits are and how local communities are going to gain from it. So at the moment, I think everyone's accepted that and taken that as read, and thank you for that. So then we've got Thrive to Work update, Sean. And by the way, before I bring you in, Sean, there was a very useful comment, which of course is absolutely true, from Lena, that actually mental health and physical health are a two-way benefit. Absolutely got that, and probably should have said that. So thank you for correcting us on that. Sean, over to you.
Thank you, Chair. So the report was submitted in the pack, which is page 165 to 170. And really what I want to just do is walk through very quickly where we are in Thrive at Work, and actually how I can garner your support for the next 18 months to help us drive the activity going forward. So very, very clearly, we ran the programme that was the randomised control trial back when we started this, and we recruited 152 businesses in a really, really difficult space, particularly small and medium enterprises. So really thank for all the board support in gaining that process. What we did is we managed to work that through as the randomised control trial, where we had the 4-armed group. So some got a grant, some didn't, which was really, really interesting to see the outcome framework from that around all of the grant delivery was given. And actually moving forward, then we actually had a really good sense of where we were going with the programme. What came out of that, though, was we created a toolkit then to go out to businesses, and that created our Thrive at Work commitment. And that's now been taken up by, well, we had 400 organisations at one stage, but due to COVID, we've lost a few along the way. We're currently running about 369 active organisations on our books, which is really, really positive. So that's really, really, really good. And then that programme actually takes you on a journey from bronze to silver to gold as a commitment for organisations, giving the organisation the tools to understand their baseline and then actually help them grow on their journey to improving wellbeing in the workspace. So having done all of that, that's really lovely. We then applied for the Midlands Engine funding, which I've presented here previously, and we were very lucky to get the funding working with Guy Daly, Caroline Mayer at Warwick, and Mind nationally to drive our programme across the East Midlands too. So we've now got a really big reach. But as you can see from the report now, it's been a really challenging time because of COVID. Organisations are really focusing on trying to keep their bottom line active without necessarily thinking about investing the time and effort they have to support their workforce, both employers or employees or even their senior leaders And what we have identified actually is senior leaders are really feeling it even more so difficult at the moment, because not only are they trying to keep the business afloat, but they're also very mindful of their workforce and having to prevent people being made redundant or furloughed or anything else. The implications on their family, it should be really important. So really important that we understand that. In the report, it highlights a number of really clear areas which are really important for us around why this is so important, because the narrative here is the biggest impact on mental health outcome for employees. And we've talked very strongly this morning about the regional health impact of COVID. And we know that work and health are two sides of the same coin. And actually, they do support a very strong correlation to improving healthy lifestyle. So actually, we can do an arena where we've got people working very well in the workplace and supporting them to stay well. Actually, that will be better for our communities going forward. So recognising that through the Midland Engine, we've got some really stretched targets that we asked for that were really, really challenging at the very, very beginning. We actually asked for 1,600 organisations to sign up to all of the commitments. That includes the Mind charity commitments, the Mind Workplace Mental Health Programme, as well as our own. But actually what I'm asking for today is to see whether we can use the Wellbeing boards and our partners in anchor institutions to help really push this forward for us and help us recruit the businesses. So through COVID, we've actually created Thrive at Home, which is our workplace agenda for the agile workers, to make sure we've got that approach. We recognise that the Bronze programme is pretty hard for quite a lot of organisations, especially SMEs who are really strapped. So we've created a foundation level now, which is a 5-step approach, which really gets them on the journey. And then hopefully listening to people like Deborah has just described, the businesses going forward is really strong. For me, that's about creating that movement going forward. So really, really positive about how we organise other businesses. So what I'd like to think about actually is about how do we use the Commonwealth Games to be a really strong lever for us to enable organisations who sign up to support the Commonwealth Games to drive their employers and support that process, so actually they sign up to our commitments. How do we use anchor institutions, both through the NHS, local authorities, our universities, our voluntary sector organisation in the region, to really push that position that saying actually signing up to Thrive at Work is so important that you demonstrate that you're looking after your people. If we're absolutely committed to that health and equality agenda, we need them to look after their people in the workplace where we have a really good time to be able to do that in a really coherent manner. And then also then think about the procurement pipeline is actually how do we do that through the social value challenge that we've currently got out. So if we are recruiting organisations to support the work and we're giving them financial public funding, actually how do we get them to be signing up to Thrive as part of that process? So those are 3 things that I'm really interested in going forward. If I put it into plain language, I suppose we've got 16 months to 18 months left of the programme. If I take the 8 combined authority main areas, that's Warwickshire and the 7 Mets, and including probably South Staffs and a little bit of Worcestershire too, that would equate to 105 businesses per local authority area over the next 18 months. When you talk about it in that way, it's actually 6 per month. That's all we want. We want 6 recruitments per month from your teams. And you have an organisation with probably hundreds of people working for you who are actively engaging with businesses every day of the week through your growth hubs, through your connection with LEPs and chambers and everything else that you do. I don't think it's beyond the wit of us all to be able to start to push that recruitment process going forward so we do hit the target. And it's not about hitting targets here, it's about getting the impact actually for our workforce. This is a free programme which has demonstrated already that actually when you implement it, and we've seen Solihull Local Authority have signed up to it and have accredited to bronze, and we've already seen the benefit that that's created. We've seen local businesses, we've seen schools, all seen the benefit of signing up to the commitment, and the impact on those individuals and the organisation is really significant. So I'm acting as a bit of a salesman, Chair, just to say, please, with due respect, can I ask that you push this more broadly? And I know we've been doing this for 18 months already, but unfortunately, it hasn't landed as well as we would like to do. We really need to push it harder this time. So over to you, Chair, and happy to take any questions, and thank you.
Lovely, and thank you very much. And of course, it is a tough time and particularly hard with COVID, but it doesn't make it any the more important. In fact, it probably does the reverse, actually. Paulette, you want to come in?
Yes, Chair. It was just a quick point for Sean. With all the difficulties that businesses are facing out there, I'm going to make a suggestion. What about speaking to the councils relating around the business grants that they're handing out and the money that they're giving for people that at the moment their businesses are struggling and what have you, to help them consider the point? Because at the moment lots of businesses are struggling. You've got lots of small and medium businesses. They can't think about all of this because they're just about keeping their heads above water. But if we could do some joined up work where the councils do something along the line with the business stuff that they're doing, I think that's a way to get it in there and get it landed, because you're then saying to them, we know what you're doing, we know you're having problems, we know you need support, but we want you to help us with that as well and find some other ways to work with them. And I'll shut up there. Thanks, Chair. Thanks.
Thank you very much, Paulette. It is a good point. And what I would just also say is that you know, some of the challenges that are also facing councils connecting with businesses are around apprenticeships as well. So, you know, and actually the challenge I'm told in that particular case, and it may well apply here, is actually the uncertainty that businesses post-April, when the furlough stops, will see. So I think there's an element of we're going to have to wait and see what happens after April. But I think the important thing for me is keep close, keep talking, keep connected to businesses, and you know, being their friend as much as anything. And that relationship can perhaps expand as things go forward. Is there anyone else wanting to come in? Can I just ask that we all do take back that challenge from? Yes, Karen, do come in.
Thank you, Chair. Some great work here, Sean. But we do know that it's quite a detailed process, don't we, to sort of go through it. And I see one of the suggestions around the perhaps a foundation level, but that is obviously in the paper. So really, it's about what are the barriers? Talking to businesses, what are the barriers to engagement in this? And, you know, is it that difficult? We're on the bronze. Is it that difficult to move up to silver and gold? So what sort of other engagement can we do supporting those employers, and obviously highlighting the absolute benefits around health, and maybe working through the LEP growth hubs, Chamber of Commerce. Obviously we've got the and good suggestion by Paulette, the local authority employer engagement teams. We have an engagement team, so it's working through those teams as well, but just really around the barriers for businesses. What are we picking up? Obviously COVID is going to be a massive barrier now, but you know, what else have you picked up?
Can I bring Guy in before we come back to you, Sean?
Thank you, Chair. So just to say, the relationship between this work and the mental health productivity pilot, which is referenced in the paper, and as part of that, as Sean was mentioning, we are going to do a significant amount of profile raising communications to endeavour to promote this and to support organisations during this time particularly, and perhaps develop some other activities which were a little less onerous, as it were, as well. So I think that there is a relationship, and sort of raising that profile. I think Councillor Hamilton's suggestion about sort of almost a sort of fiscal incentive type approach was also a useful innovation.
Thank you. Sean, back to you.
Thank you, Chair, and thank you, Councillor Grinsall. Really, really good challenge. So speaking to businesses, I think the challenge is that the narrative is very, very clear. Everybody absolutely gets the moral imperative of trying to do it. But actually, the absolutely fundamental of getting people to do this now is when they are trying to state. A lot of small and medium enterprises don't have a HR organised part of the organisation. They don't have a legal framework. It's really, really hard. They generally have someone who's a chair of a board who might be doing some additional pro bono work for them in this space. So what we've tried to do through the foundation level is make it as light touch as we possibly can, because the bit for me is really important. I'd rather they did something small than actually do nothing at all. And actually we can then measure the impact going forward. So the foundation level was very, very clearly delivered. It's described as a 90-day sprint. It doesn't take 90 days if you can do it as quickly as you want, in line with sort of business process approaches. But it does help you to understand what the implications are for your organisation, what some of the challenges are. And it's a top-down and a bottom-up approach, which is really important, actually. So people feel really bought into the process. And all you need to do for that bit then is to work with the organisation and then create a bit of an action plan going forward. So it's just slightly more than a pledge, but it actually helps you to get an understanding of where you're at. That will then hopefully give people the ability to get onto the bronze going forward. But recognising how difficult it is at the moment, we're really important that we deliver that. But actually picking up Professor Daly's report actually and comments that actually the broader Midlands engine is offering lots of other things too. So lots of interventions around keeping people well in the workplace who are off sick, supporting people who've got some sleep challenges around workplace productivity, CBT connectivity, and a whole host of other options, as well as broadening out things like This Is Me campaign, Every Mind Matters, mental health first aid, and a much more composite view. And actually we have recognised, actually, even if we get people just to pick up the first stages of that bit, actually then move on to the broader commitments afterwards, we're really happy. But I am trying to make sure that actually we drive the numbers through, because actually we can then demonstrate a scale and impact for our region. Because at the moment, 369 businesses are totaling about 125,000 people. Now, actually, it'd be really lovely if we could impact that even more and greater.
Yeah, Sean, that's fantastic. And I do think we should all take back the challenge, which is, what can we do? Bearing in mind that there are challenging times, but we just need to keep the door open. We need to keep there, and as things get better, I hope that we will see much more progress in this. But there will be businesses that we can reach out to. So thank you for that, and for the challenge too to us. Great piece of work. We're doing really well on time, I have to say. We've got 5 minutes, and we're just going to be talking about items for future meetings. There's none specifically, but I'm going to put a suggestion forward that we might put on the ICS paper that's just been out around the NHS, the new paper around NHS and ICSs, and what that might mean for our region and our area. And I don't know whether now is absolutely the time, but we're sort of in the middle of it, and I think it could be quite interesting. Ed, do you have any comment on that?
I think that would be a great idea. I think that the paper that Rebecca's shared today is really very important, and I think to spend a bit more time on it would be really good. And just to put that in the wider context of ICSs, I think that would be a very helpful thing that we could talk about. Good.
So we'll put that. Is there anything anyone else would like to bring forward as a suggestion? And there's no importance to think about it now. You're more than welcome to forward a suggestion on to us. So that's the start.
We should probably say that at the moment Mubashir is working with the team to look at what our the terminology we use within the combined authority is high level deliverables. Is what are the key priorities going to be for the next 12 months? And I dare say that it would be useful to talk about some of those things as well.
Thank you. That would be helpful. And so I don't see anything else. Can I then move us on to the date of the next meeting, which is the 26th of March. I fear we may still be doing it virtually at that point, but let's wait and see. We're hopefully getting towards the end, but not yet, I don't think. So thank you all for your input today and for your attendance. And
Chair, we've got a question, Chair.
Have I? Oh, I'm so sorry. I've got a bright, dazzling sunlight in front of me, and I'm really struggling to see. Who is that from?
It's me.
Oh, Les, is it you?
I just wondered if that date could be affected by PERDA.
You can still carry on the work.
I don't think we're.
Right.
Yeah, I think PERDA affects how newspapers report, and I'm not sure it's a political report. I don't think so.
No, that's fine. That's
yeah,
fine.
Thank you for that, Les. So I hope that date will be okay for everybody. And thank you for your attendance. Thank you for your input, and have a good weekend ahead. It's very bright and sunny out here in South Warwickshire.
It's lovely.
Thank you, Chair. Keep safe.
Thank you,